A No Medical Insurance Guide. Chapter 1. People with no medical insurance. No health insurance due to poverty or pre-existing conditions. If you have no health insurance, try the Social Security Disability Office, ssa.gov, medicare.gov, medicaid.gov, social assistance from your state health and human service office. Try the big societies and associations and the federal government's National Institute of Health for help too, nih.gov. Make an appeal to the drug companies supplying your drug. Try the Pharmaceutical Research and Manufacturers Association at 800 PMA Info and ask for their directory of prescription drug patient assistance programs. In order to qualify for Medicaid, you have to be very poor. A lot of low and middle class people who don't have much money but too much to qualify for Medicaid don't buy health insurance because they need the money for other things. If you have no health insurance, by federal law, the emergency services of hospitals and clinics have to take you in and treat you. However, if they find something wrong and recommend surgery whereby you'll have to be admitted, you move to another category called inpatient where they're not responsible to treat you, so in essence they can run a test and tell you that you have cancer but they don't have to treat it. They'll send you bills for your emergency room treatment which you won't pay, which will destroy your credit unless you lie about your name and SSN at the outset. The federal government ruled that all states must have some type of mandatory coverage for a medically uninsurable person, someone who has been rejected by the private market due to pre-existing medical conditions. When a private company sells a policy to someone with a serious health condition, they call it a high-risk insurance plan. As far as I know, 33 state governments provide coverage to medically uninsurable people, which means you can either buy an insurance policy from them or buy one from a private company with some kind of guarantee from the government whereby they will take over payments if medical bills go above a certain amount. For the other states, there are some organizations and aggressive medical insurance companies willing to insure the uninsurable generally for a high fee with exclusions in the policies. Some private insurers offer state-guaranteed policies with conditions to them. There is always Medicaid for poor people provided you have below their standard for assets and earnings. Refer to local community health centers. There are low-cost and free medical clinics around that help low-income people that have too much money to qualify for Medicaid. You have to look around your local area for such places. Ignorance is the greatest downfall of uninsured people as to getting the free and low-cost help out there. Some municipalities and states have programs for both uninsured working poor people in general and middle-class working people who don't really have enough money to afford high health insurance rates, but you have to look around to find them. Look in your local phone book under the several levels of government, find a public health office, call them and ask about medical assistance for uninsured people, whether they have clinics or programs. Some clinics are free, some charge a few bucks per visit and provide medical, dental and eye care. You have to find them on your own. Medicaid, the federal government program for low-income people without health insurance, is a tedious bureaucracy that has many loopholes before you qualify. When you apply, the system makes it seem like they want to keep you out rather than help you. You either have to be unemployed, make under a certain amount of money, or be disabled somehow, disabled being defined as unable to work for the next 12 months or in danger of imminent death as determined by your doctor. Be ready for a battle when you apply to Medicaid. If you're in dire medical straits and apply for Medicaid, don't wait for approval to get medical treatment because you might die in the interim. Make a payment plan with the hospital where you offer to pay $10 a month or whatever you can afford, anything to get in. Barring that, contact the media, governor's office, politicians, etc., asking them to help you get your Medicaid application approved. No health insurance websites / high help websites. Copays.org, Patient Advocate Foundation Pay Relief. CoveredHeUninsured.org. CoveredHeUninsured.org/content/resources-uninsuredhealthinsurance.com. Healthinsurance.org, state programs for those who cannot get medical insurance. InsureKidsKnow.gov/states.asp, 877, KIDS, NOW. KFF.org, Kaiser Commission on Medicaid and the Uninsured. kff.org/uninsured/index.cfm, naschip.org, the National Association of State Comprehensive Health Insurance, naschip.org/states_pools.hdm, high-risk pools information, nhchc.org, National Healthcare for the Homeless Council, patientaccessnetwork.org, Patient Access Network, correctcoverageinsurance.com, specializes in life insurance for impaired risk, serious medical conditions, people who have been refused. coveringkidsandfamilies.org, familyvillage.wisc.edu/hospital/highrisk.html, unitedproject.org/tags/no-health-insurance, voicefortheuninsured.org, Marry a Canadian for Health Insurance, hook-a-canuck.com.